field reproduct and clinic operation manager, and emergency.
Just to share to view what has been done with the ELVA therapy, what is today the standard and what will be hopefully the close future. The device with fully levitated rotor inside the pump, there are actually mechanisms. The idea behind it is that with the LVAD patient, we can definitely improve the optimization. We can improve the right ventricle function. We can improve the medication and the monitor the deterioration. And definitely we can help to prove better timing for the indication for the transplant. There are already preliminary studies which are focusing on the using driving management, LVAD management based on the CardioMEMS pressure readings, and they prove that this concept definitely has a sense, and of course they are working on the preparing kind of maintenance and the guidelines for this usage. A completely different story is using CardioMEMS with a total artificial heart or the biventricular patients, because with these patients, with helping the CardioMEMS, we are getting more data on the preload parameters. So again, we can definitely improve the patients being at home and not getting deteriorated because of lack of data. Another strategy which Abbott is looking is using the ELVA therapy for the small population. We are going the smaller population, small adults, women, or pediatric population. There is a lot of new let's say topics to be discovered. There is a limited clinical experience. There must be different clinical practice. There is an open question remain for the different indication, different etiology, congenital. So we are working on that. For the small patient, we already develop new accessories for the surgical easier implantation. We work on the decreasing, on the adjusting the software, like a decreasing flow alarm for the small patients, which we will implement also soon in the current technology. There is always a lot of questions, what will be next? What will be next? So I always am saying we are focusing on today. We want to improve the patient management. We want to improve the quality of the life. But of course, we are working on the time with our R&D development on the new products. So if we look on the vision where we are focusing, with next step, with the next pump generation, we are going for the smaller pump. We call it HeartMate 3 Mini. And then we are, of course, working on the new generation, completely new generation of the pumps, which maybe HeartMate 4. We know, so this pump, we want to be more, not only hemocompatibility related, but we definitely want to be more incorporated with the native heart function. So driven with the ECG, better monitoring the pressure and better adjusting to the patient activity. We definitely working on the new peripheries. So the current peripheries, like a controller, batteries, they are well established. We have a great experience. Patients are definitely giving good results, but we are working on the new controllers which will be communicating wirelessly with the hospital systems. So you will get the data soon, and definitely the next generation we hope that will come to the completely implantable system in the future. And if we look also to the, let's say, the hospital accessories, we are looking in more working system connected to your internal hospital monitoring system and the databases, so you can have the data not only on the special hour platform, but you can incorporate it, all the data in your standard daily practice. Thank you for your time.